You are watching this video because your child has been diagnosed with developmental coordination disorder or is suspected to have DCD. This is the first of a four-part educational module for parents that are seeking to learn more about DCD and what the diagnosis means for their child. At the end of this presentation, I hope that you would have learned enough information to answer the following questions. What is DCD? Why does my child have DCD? Who can diagnose DCD? Where should I seek help for my child? So what is DCD? DCD is a seemingly common motor disorder that affects 5 to 6% of school-aged children. Most researchers agree that there are more boys affected than girls. Though the disorder starts in childhood, DCD has a lifelong impact, and the challenges faced by children persist into adolescence and adulthood. Though the primary impairments are motor-related, DCD can have significant secondary consequences, such as low self-esteem, anxiety, and depression. Research has shown that without intervention, many children with DCD will continue to have difficulties in adulthood. Though DCD is a common disorder, most parents are unaware of the term. Most parents may be more familiar with the terms clumsy child syndrome, dyspraxia, or sensory integrative dysfunction. In an effort to facilitate uniformity in describing these children with motor coordination issues, the term developmental coordination disorder, or DCD, has been adopted worldwide. The DCD diagnosis is generally given by 5 years old, but signs can be seen earlier. There are also risk factors that have been found to increase the chances of children having DCD. According to several studies conducted within the past decade, children who were born premature and/or with a low birth weight are at higher risk of acquiring DCD. Children with ADHD, autism, speech-language impairment, dyslexia, and learning disabilities also have a higher chance of having an additional diagnosis of DCD. Other risk factors noted were having family history of motor coordination issues and having had delayed walking and talking skills. What are the common characteristics of an individual with DCD? We will get into more detail on this in the next two modules. Individuals with DCD are usually described as being clumsy or uncoordinated. They present with either gross motor or fine motor delays. They can be described as being slow because they need more time to figure out what they need to do. Individuals with DCD have difficulty learning new tasks or skills, especially tasks that require anticipation and adaptation to change. For children, this could be activities like playing team sports, where they would have to anticipate their teammates' movements and adapt their response to match their teammates' efforts. For adults, this could be an activity like driving, where they need to change lanes, merge lanes, or deal with unexpected traffic issues. Individuals with DCD often have anxiety. Their self-esteem can suffer from being excluded by peers due to their clumsiness and awkwardness. They get anxious when asked to quickly accomplish a task, and they tend to anticipate failure. Individuals may say, "I can't do it," or "it's too hard for me." To have a formal diagnosis of DCD, All of the following criteria have to be met. First, your child's gross or fine motor skills are delayed based on standardized tests. Second, these poor motor skills affect your child's activities of daily living, such as feeding and dressing, his ability to play with his peers, his academic skills, or his handwriting. Third, the delay started early or in childhood. And lastly, your child's poor motor skills are not because of any other known neurologic, medical, genetic, or psychological condition or severe intellectual developmental disorder. Why does my child have DCD? There have been multiple studies conducted within the past decade to determine the part of the brain that is responsible for DCD. Neuroimaging studies like MRI have been conducted in children with DCD. What these studies have shown are that different parts of the brain are linked to the dysfunctions experienced by children with DCD, such as the cerebellum, which plays a huge role in movement, balance, coordination, and making movements automatic. The basal ganglia, which plays a huge role in initiating movement, motor control, and motor planning. And the parietal lobe, which plays a role in processing sensory information, proprioception, visuospatial information, action prediction, executive function, and motor imagery, all of which are areas of deficits in children with DCD. Despite these studies, however, there is no known cause or clear brain signature for DCD. Who can diagnose DCD? A DCD diagnosis is given by a physician because other causes of the motor coordination issues have to be ruled out first. Because treatment intervention for DCD is different, physicians would need to consider if a child who already has an existing diagnosis like autism, ADHD, speech-language impairment, also has DCD and refer the child to appropriate services. Your child's physical therapist and occupational therapist have a huge role to play in helping confirm the diagnosis of DCD. They use standardized tests to compare how your child's motor skills fare against typically developing children. You can be asked to fill out questionnaires inquiring about your child's coordination and quality of life. The results of a comprehensive evaluation from a PT and OT will assist the physician in affirming the diagnosis of DCD. Where should I seek help for my child? Consult with your physician. If you haven't already voiced your concerns with your pediatrician, do so now. The pediatrician may refer you to other specialists to rule out other disorders or conditions that may cause these motor coordination issues. Consult with a physical therapist or occupational therapist. Most likely your child is already getting PT or OT or both. They will provide the most appropriate evidence-based intervention for your child and will guide you in understanding your child's challenges and what you can do to support them. There are great online web resources for DCD that can supplement the information presented in this module. Though DCD is not as well known to parents as it should be, it is well known to researchers, and there are a great deal of information about it on the internet. Here are additional online web resources that you can visit for more information on DCD. These presentations and videos are done by experts in the field of developmental coordination disorder. This is the end of the first module. Feel free to view it as many times as you need to get a good grasp of what DCD is. There are 3 more modules that you will get to view, and those will cover the challenges experienced by individuals with developmental coordination disorder, first as a child, then as an adolescent and adult. They will also cover the treatment intervention and strategies that health professionals and you as a parent can use to help your child.